After surgery, some may notice swelling or a lump that sits right under the skin, usually around the area that has an incision site. What is this? Well, it could be a seroma. A seroma is a pocket of fluid that sits in pools right under the skin. What do you need to know about this, and how do we get rid of them? My name is Kelly, and I'm a physical therapist that specializes in cancer rehabilitation as well as lymphedema. And today in this video, I'm going to share why seromas form and the various ways that they are treated. But before we begin, make sure that you subscribe down below for weekly new videos. You can also follow along with us on Instagram or check out my website for more resources. So first, seromas hold clear fluid that's not infected. If there ever is a concern, if there is an infection, then it's incredibly important to seek medical help right away. So why do seromas form, or what causes them? Surgeries where there is tissue removed or moved all can lead to a seroma. Often I see them after surgery for breast cancer, abdominal wall surgeries, or even liposuction. Tissue is generally been removed or moved in these surgeries, and that leaves a dead space or an empty cavity in that area. And that can fill with fluid and create a pocket or a lump that can become firm because it is full of that fluid. This usually happens soon after surgery or even a few weeks later. So how are seromas treated? Some seromas are painful and some are not. They tend to be painful when they get really full or large. The very small ones are eventually absorbed by the body again and really don't need any treatment for them. If it's small but it's stubborn and someone wants to try to get rid of this and speed up the process to get rid of the smaller seromas and the body's just not taking care of it itself, then we can apply a gentle pressure to that area, and that can be helpful. If someone has a seroma after breast surgery, then a compression bra like this one from Prairie Wear can be really helpful. This bra was created for swelling and lymphedema and can work great for this kind of edema too, because it is full coverage bra. If someone has had an abdominal surgery or a pelvic surgery, then compression shorts with full coverage or possibly a compression tank top or a shirt would be a good option. Whatever is used, it should be comfortable with minimal seams to avoid any irritation and friction over those incision sites. Another option for more localized support and compression is using a swell spot like this or this. Swell spots come in various shapes and sizes, and they can go inside a compression bra, tank, or shorts, or under a snug article of clothing of some sort, and to give that extra pressure and support to that seroma. They are really soft, like a little mini pillow, so they don't cause any pain. I will place links to these products down in the description box below that you can check out if you want more information on them. If someone has a large seroma though, or one that's has gotten infected, then this needs to be addressed by the surgeon or the doctor. If it's infected, antibiotics are typically prescribed, but the larger seromas tend to be drained or aspirated using a needle or a syringe. There are times that a seroma can return after this and needs to be drained a couple of times. But we try to avoid this from happening by adding that gentle compression we spoke about before to that area after that seroma is drained, to avoid that space from filling back up, and to have that compression on until it can close and heal fully and there's no longer the space for that fluid to sit in eventually. And now in severe cases, the seroma may have a cyst-like sac of tissue or scar tissue, which will need to be surgically removed in the cases of the chronic seromas that are bothersome and painful. These large seromas are at a higher risk for infection, so it is important to communicate with the doctor regarding any concerns and options. Seromas are not lymphedema. Those are different, and generally they stay localized to that specific area. But if there ever is a concern or question, then it's best to work with a certified lymphedema therapist or your doctor for that personalized medical guidance. So that's generally how we treat a seroma and what it actually is. You can find more resources on my channel as well as on my website. Again, if you want more information on these swell spots that can help put that gentle pressure against a seroma or that pocket of fluid to help make sure it's getting absorbed and goes down in between, or if for different compression bras or compression shorts or tank tops, I will put all of those links in the description box down below that someone can check out further. If there's ever a concern that it needs to be surgically removed, again, the next best step is to work with a doctor or your surgeon because they're probably watching it anyways, but make sure that they're in touch and communicating with them to know when that next step might need to be taken. Anyways, I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.